Okay, so my name's Mr. Glory Abasa. So on this question, I want to appreciate everyone for making an attempt. To be honest, is a very tricky question that require you to have a very an understanding of the rules that are involved in answering such a question before you can be able to answer the question correctly. Out of the total number of persons that responded, I think about 3 to 4 persons got the answer correctly. Now, there are rules that guide this kind of question. If you know the rule that guides it, you'll be able to know how to escape the errors that are inside this question that will enable you get the correct answer. So the question is, an elderly woman who had senior dementia is admitted to the long-term care facility by her son. During the admission process, the son says to the nurse, Did I do the right thing to bring my mother here? Which initial response by the nurse will be most helpful? A. Say to the woman, you will like it here. We will take very good care of you. 2. Ask the woman if this is comfortable, if she is comfortable, or if there is anything that can be done to make her feel more comfortable. 3. Tell the son you made the right decision. We will take good care of her, which almost everybody went for. 4. Say to the son, it must have been very difficult to make this decision. Now, in answering questions like this, there are rules. There are rules that we must follow. The first question is, we're going to ask ourselves is, who is the patient in this question? Who is the patient in this question? Now, let's read it again. An elderly woman who has senior dementia is admitted to the long-term care facility by her son. During the admission process, the son says to the nurse, Did I do the right thing to bring my mother here? Which initial response by the nurse is most helpful? Now the question is, this whole conversation that is going on the whole conversation is centered around the son and not the mother. So on this question, the son is the patient and not the mother. I know it sounds very crazy, but the son is the patient that needs to be responded to and not the mother. Why? The son is the source of worry. So if the son is the source of worry, which means the son is the person that should be responded to. 2, there's a rule called the rule of therapeutic communication. We're going to talk about it later as we move on. Therapeutic communication. Therapeutic communication says that when a patient presents to you with a question of or a concern of or a statement of concern, there is what we call open-ended communication. That's to say, you don't ask the patient or respond to the patient or ask the patient a question that would demand yes or no answer. That's to say, when you're responding to a patient who is questioning you or a patient who has a concern, responding to such a patient should promote open communication. 2, you don't give false assurance. You don't give hope to a patient that says, don't worry, you'll be fine, everything will be okay. Why? Because such communication or such response does not promote open communication. So let's apply these 2 rules and then answer this question. First rule says you must be able to identify who the patient is. 2, therapeutic communication. And I say under therapeutic communication, you don't give false hope. 2, you must be able to encourage open communication. First, identify the patient. Two, you don't give false hope. 3, let your response or let whatever you say promote open communication. Now, like I said at the beginning, who is the patient in this question is the son, because the son is the one that is worried and not the woman. So any response that has to do with the mother is out of the way. So if the question says an elderly woman who has senior dementia is admitted to the long-term care facility by her son, during the admission process, the son says to the nurse, "Did I do the right thing to bring my mom here?" Which of the following response by the nurse is most helpful? A, say to the woman, "You will like it here. We will take good care of you." Number 1 is out of the way. Why? Because this question is not referring to the woman, but the concern is about the son. So, number 1 is out of the way. Number 2, ask the woman if she is comfortable or if there's anything that can be done to make her feel more at home. Like I said, the patient here is the son. So anything that has to do with the mother, out of the way. So number 1 and number 2 are out of the way. So the only 2 options we have is number 3 and number 4. Now number 3 say, tell the son you made the right decision. We will take good care of her. You made the right decision. We will take good care of her. Now the question says, the son says to me, did I do the right thing to bring my mother here? It means that the son is worried. Not just worried about the fact that he brought the mother here. It's possible there are other things that are bothering him. So when you say to the son, you made the right decision, we will take good care of her, that is false reassurance. 1. 2, you have closed the communication you are supposed to have with the son, because it's possible for him to be saying, did I make the right decision? It therefore means that there are other things that he wished to talk about that he has not said. So when you ask him by saying, number 4, say to the son, it must be very difficult to make the decision. It must be very difficult to make the decision. When you ask him that statement, say to the son, it must be very difficult to make the decision. He going to respond to you, yes, it's very difficult. Reason being that, meaning you have created an avenue for communication. It must be very difficult you make the decision. Yes, probably I had to make this decision because of this, he will open up to communicate with you more. So, in therapeutic communication, when a patient presents to you with a question, number 1, you don't give a yes or no response, meaning you don't ask a patient question that will allow him give a yes or no answer. 2, ask open-ended question. 3, don't give false hope. So in response to this question, number 4 become the best option. Number 4 says, say to the son, it must be very difficult to make the decision. When you say that to him, it's an open-ended question that will allow him to talk more, to express his concern, that by asking, do you think I made the right decision in bringing my mom here? So that is how we go about this question. Thank you.